Welcome to the Tooth Truth with Dr. Scott Parker podcast. Specifically, this is the Clenching and Grinding edition. We're glad you can join us. My name is Dr. Scott Parker. I'm a dentist. I'm a clinical instructor. I'm a key opinion leader for the dental profession. I've traveled the world teaching dentists how to deliver better dentistry, as well as improving patient experiences. Several years ago, I retired from clinical practice and I solely focus on teaching and developing new technologies, as well as being an advocate for patients. My passion is teaching, and this passion is what led to hosting a podcast focusing primarily on helping the general public better understand all things dental. Over the next several episodes, we're going to do a deep dive into the world of Bruxism, specifically with a focus on making it easy to understand from a general consumer's perspective. We'll be talking with world-renowned experts who have had success helping people with this challenging condition. And then I'd like to first introduce a couple of guests. First, I'd like to introduce Lauren Wilmore. She's the head of marketing for Zerene, a company that's leading the charge to bring clenching solutions to the general market. Hi, Lauren. How are you today?
Awesome. I'm excited to hear everything that you geniuses have to say.
Thanks, Lauren. We're glad you can be here. Our next guest is actually a subject expert, Dr. Mike Smith. I've known Mike for, what has it been now, Mike? 25, 30 years?
Getting close to that. Don't
And
give us our age now.
I don't want to give too much away, but I've known Mike for a long time. And I would consider, first of all, Mike is a dear friend. But second, and probably more important, Mike is one of the most educated people in this field of bruxism and what we call clenching and grinding in the general public. And he's one of the primary people who lectures around the world also on how we treat this devastating condition. Bruxism has just really, really significant implications for our patients. And these are not only devastating to our overall health, but also our general quality of life. And most people are aware of clenching and grinding in dentistry. We specifically refer to it as bruxism, but for the most part, they're one and the same. So, Mike, thanks for being able to join us tonight. I know you're busy. I know you're running all day long, and this is really where your passion is. So thanks for being here.
Absolutely. It's my pleasure. Anything that we can get out to, especially the public, to help inform, make them more aware, to get better health and to get better choices, it's all worth it. Every time we spent to educate somebody to get them healthy, it's a win-win for everybody.
Absolutely. And I know that's really where your heart and where your passion is. So thanks for taking the time. I know you're busy. Before we get deep into this subject of clenching and grinding, more important for me, and it really helps us better understand a little bit about you. Tell me your story. Like, why dentistry? How did you get into dentistry? And then specifically, what kind of pushed you into this whole jaw joint clenching and grinding field?
Well, I would have to say it's kind of in my genes. It really is. I was born into a dental type family. I'm a third generation dentist here in Phoenix, Arizona. My grandfather started a practice in 1928 downtown Phoenix. But that's not it. Not just three generations in my family. I'm the seventh generation in my family to be a dentist. So everything that revolved, dinner conversations, vacations, everything that we did was all about teeth, spit, blood, how to make people smile. I mean, and that's everything. I mean, my whole life grew up that way. Did I want to be a dentist at the very start? No, I was going to go somewhere in medicine. And then I realized I really love dentistry. And it's just phenomenal on things that we can do to satisfy somebody's oral condition or other systemic problems that are coming from an oral condition to get them healthy, make them smile, and make them feel better about themselves. So it comes in, basically, it's in my genes, man. That's dentistry is. Now, the TMJ related or clenching, grinding, pain anomaly type situation came from when I was in dental school learning about different ways to do oral rehabilitation. And I realized in the early stages of the reconstruction, rehabilitation, prosthetic phases for patients is a lot of these patients struggled with a bad jaw joint or muscle problems or breaking their teeth down. And all that kind of stems from this thing that you were talking about, Bruxism, clinching, grinding, where they're putting too much force on their teeth and they're causing some part of their system to break down. And so it got me really, really excited about what can I learn, what can I do, and how can I solve these problems so when I am rebuilding a smile, then I can do it in the best way possible where this patient's going to have a healthier environment for a very long term and have it last a long time. And the best thing is, man, you get a patient that comes in pain because of that. You get them out of pain, they love you to death because it's rewarding on every avenue of that. Because if you have to dealt with that kind of pain all the time, getting rid of it makes a huge difference in your quality of life.
Absolutely. And that whole chronic pain, that whole channel is just filled with despair and people that are struggling.
Yeah.
And so to have an expert like you that can actually help them and alleviate these types of pains, it's been just amazing to watch. And I've watched your success over the years, and it's what I would call meteoric, just because you've done such great and amazing things with what you do. So thank you, not only from a patient's perspective for what you do, but also as a profession. Thanks for leading the charge of educating other dentists too, because I know you do that around the world as well.
Absolutely.
So thanks for joining us. Tonight, as we specifically focus in on clenching and grinding, I'm probably just going to refer to it as bruxism from here on out, just to make it easy.
Yeah.
But let's start with maybe the very basics. What is bruxism? What is this condition?
Bruxism is a term that we use in the dental lingo of the patient is putting their teeth together, smashing, crashing, and bashing them together with undue force, where they're putting extra force through the tissues and they don't know why they're doing it. And it can be nighttime related, it could be daytime related. And where they're basically the bottom thing is they're clenching, they're grinding their teeth, and they don't really know that they're doing it. And it can just destroy everything in the whole complex. So it's an overforce of overfunctioning of their normal environment that breaks down. It breaks, it chips, it fractures, it causes inflammation, it causes pain, not just with the teeth, but it causes inflammation of the ligaments, the nerves, it causes inflammation of the jaw joint, and it causes inflammation or hyperactivity of the muscles, which causes more pain, causes headaches, causes other systemic type of inflammatory disorders that go along that can affect their general health.
Interesting. So it sounds like we have two different types of bruxism, and I know it's probably that's probably an oversimplification, but for example, I see daytime bruxism. I was at a gym and I saw a man working out. He was very, very well built, but as he was pushing hard on this weight, I could see him clenching his teeth so hard. So I would consider that a daytime grinding habit. Versus maybe somebody who's asleep at night and they're not even aware that they're stressing their body, but they're releasing this stress through their teeth and grinding. And I think everybody listening might be aware of this because we hear this a lot in, say, children when they're young. We hear that squeaking of their teeth as they're grinding their teeth at night when they sleep, as a way of their body releasing some type of stress or anxiety or whatever it might be that leads to this condition. And it's not just stress or anxiety that leads to these types of conditions.
Right.
There can be some other systemic challenges that you mentioned, as well as medications that trigger it.
Yeah, medications, stress, of course. Airway issues, breathing issues can also be an anomaly that goes along with that. And then a lot of it can just be a neurological habit where they don't know why, but the body's host response is, hey, I'm going to brace. I'm going to try to stabilize my system and put my teeth together. And I'm going to try to hold on to whatever else is going on so I can get past it. And really, that's one of the things that goes on is, and people go, I don't grind my teeth. Well, just clenching your teeth in a static environment where they're together all the time is just as bad as if you kind of grind them side to side, or even worse, because when you're in compression and you're putting all that force into the teeth and the gums and the nerves, you're causing a lot of inflammatory breakdown damage. So the biggest thing is it's a normal response of, hey, I'm going to put a lot of force and I'm going to clench. Oh, goodness. Well, yeah, if you have something out of balance and you start clenching, well, then that out of balance can cause an effect to the jaw joint, the muscles, or other teeth that get too much pressure that can cause further damage. Now, that daytime component is a little different than the nighttime component, as you were saying, because when you're at night, when you're asleep, you don't really realize that you're putting your teeth together, or you don't realize that you're putting teeth together and you're like grinding them side to side like a chainsaw. One of the things that I keep hearing from patients all the time is, it's like I wake up and I feel like I'm chewing on glass, because they're trying to solve a problem. And some of that problem has to do with nerves and stress and air. And there's a lot of things that can induce this nighttime clenching, grinding episode, along with the airway issues. And one of the big things they say is, oh, if you can control the nighttime clenching and grinding, you'll be fine all day long. But patients actually put more damage to their teeth because during the day they have more wake time than they have sleep time. And what we've seen in studies, where we've seen studies of patients, they'll have nighttime grinding episodes. Those nighttime grinding episodes may only be like 30 minutes of entire time through the night. But their daytime physiology, they may put their teeth together for 6 to 7 hours during the day versus nighttime. So they don't realize that daytime clenching grinding is just as bad, if not even worse, than nighttime. You're just sometimes not aware of it.
So it's an interesting dynamic, because maybe if we're awake 16 hours a day and we're asleep 8 hours a day, which is common for a lot of people,
Yeah.
During the daytime, and maybe you can answer this in just a second, is it true that we clench harder at nighttime than we can at daytime because we lose an inhibition nerve response? But second, if we're clenching for 16 hours and say putting 400 Newton centimeters, or just whatever the measurement is of force, into our teeth for 16 hours, but we're doing it at 4,000 Newton centimeters at night for 8 hours, those are two completely different dynamics. So talk to me just a minute, for just a minute, about the nerve response and our body's ability to inhibit the clenching during the daytime versus, say, nighttime, when we lose that inhibition and we can really, really bite down hard.
Yeah. So during the daytime, you have nerves that are giving you a proprioceptive response that your teeth are together. And
Tell me what proprioception.
Your nerve has a memory. Like all your nerves are saying, hey, if you do this, something's going to happen.
Yeah.
So what's going to happen is your body's response is going to say, hey, buddy, you're putting your teeth together. I think you've got past that, let go. So you won't put as much pressure or force because you have nerves that are protecting your system, and those are awake nerves. Now, the problem with daytime is you can put your teeth together a lot more times over a repeated cycle, but it may not be as hard as when you're asleep. Now, when you're asleep, you lose that recognition, that nerve, that proprioceptive nerve recognition goes away. So when you put force on it, especially if you're in REM sleep or if you're in a deep sleep state, and you put that extra like 3, 4, 5 times pressure through the system, through the tissue, the teeth, the nerves, the bone, the jaw joint, the muscles, well, that can cause like immediate damage or even a hyper response damage because you're putting so much extra force. And it may be lower time, but it's like running your car into a bush versus running your car into a brick wall. Okay. You're going to run your car into a bush during the day and you're going to realize, oh goodness, it's just, I got to let go. I got to stop. But like at night, you don't know it. Basically, it's just like running your car into the brick wall. You don't have that protection response saying, hey, let go, like you do during the daytime.
Great, great, great explanation. So proprioception equals the protective response. That's a
Yeah.
great definition. Thank you for sharing that. For those of us that have been to a doctor where we use like a rubber mallet on our knee, that's a knee jerk response. We call that a nerve response. It's a feedback response. It's kind of a similar thing. Our body will tell us not to clench when we're conscious and awake, but at nighttime when we're asleep, we lose that proprioception or the protective nerve response. So we can actually clench down with a lot more force.
Yeah.
So interesting story. Mike, I think you know this. I'm a drummer. I've played drums for 35 years. I've played in lots of bands, big shows, all that kind of stuff. And I love doing that, but I have a
You know,
really
you need to grow your hair back out if you're going to be a better drummer, right?
when Mike and I met, I used to have hair all the way down to my shoulders. That was a long time ago.
Yeah.
But as a drummer, I'm always hearing rhythms. Now, the reason I tell you this is I actually tap my teeth together when I hear rhythms. And so this could be defined as a form of bruxism
That's a
because
form of bruxism. Yeah.
I'm not consciously grinding my teeth to relieve stress. I just do it as a habit because I'm tapping out rhythms on my teeth. It's a very strange thing. But now that it's been several years I've been doing this, I can actually see some of the wear patterns on my teeth from tapping my teeth together. So similar situation.
Yeah. It's an undue, uncontrollable response of bringing your teeth together, either in a static environment like you are, or in a crazy environment by grinding all the way around. It
Yeah.
all goes back to over force, over function.
So Mike, next time you see me, if you see me focusing or you notice I'm tapping my teeth, always ask me, what song are you playing there, Scott?
Absolutely. I say,
Uh,
what kind of note are you going to hit? Are you going to do a big bang?
yeah, absolutely. Um, okay, so you said something in there too about the jaw joint, and I hear this all the time. And of course, as a professional in this field, I know the difference. But let's spend just a minute defining the difference. I hear people say all the time, "Oh, I have TMJ." In our profession, we call it TMD, where TMJ is something very specific. Can you just define for us a little bit the difference between TMJ or TMD or whatever it is that we might call these types of conditions?
Yeah, so the common nomenclature is TMJ, which basically goes to TMJ, you have two of them. That's the component of the jaw joint. So you have a joint on the right, joint on the left. For most people, well, I get some that only have one, but definitely that's the general population. You have two TMJ or temporomandibular joints. Now, when you get into the term as far as a condition, a disease, a disorder, you're going to have a TM, they call it several different things, TMD or TMJD, which is a jaw joint disorder of the entire complex. It's not just the joint itself, it's the joint, the supporting nerve structure around it, the soft tissue, the cartilage, the ligaments, and the supported muscle structures that go along with it. And then that all connects to the teeth. Now, one of the things that I talk to with patients or with doctors on my lectures is that, you know, the jaw joint is like an extremely important component for all our oral structures, because that's the first start of where our mechanism starts of our jaw opening and closing. So it's our first component of the jaw joint, the jaw joint. Now, you get the muscles and nerves and everything that fires and hyper response to bring the teeth together. Then once the teeth come together, it compresses into the fibers into the bone, and then it transmits that fiber, the pressure back to the jaw joint. So the jaw joint is the start of our, we call occlusion, but bringing your teeth together, and it's also the finish. So it's two components in that process of function. And so that's why it's so important with the jaw joint. Now, if this joint's inflamed, or if this joint is dislocated somehow, and you bring your teeth together, it's going to cause some kind of rocking mechanism. Now, that rocking mechanism can also induce more bruxism because you're trying to solve a problem. Your body is saying, hey, I want to just bring these teeth together. But by bringing them together, it's causing another motion because something's collapsing, like a jaw joint collapse. So it's going to induce this constant bruxism, or this fulcruming factor that's going to cause more inflammation, pain, discomfort, breakage, all the things that go along with the sequelae of bruxism or clenching and grinding your teeth. So it's at a very important joint because it's the harmonious balance of opening, closing, chewing, functioning. And without that joint, it makes it a little bit more difficult to have a normal function. And then you also have to have the components that go along with nerves and muscles and airway and all that stuff, because our basic component is to breathe. Well, if our jaw joint's in a bad spot and it's locking or it's inflamed, we have to reposition this jaw joint to try to breathe. And then that's going to cause extra muscle function or extra stress in the system.
What a fascinating conversation. There's so much more to it than just a simple little joint.
It's
just
more than just, a little hinge, and it's more than just a tooth hitting. You have all this playing together that has to be orchestrated in the right way, or you're going to have something that gets out of balance, or as like you, a musician, out of tune. And if you're out of tune and you're out of tune for a long time, it's going to hurt your ears.
Yeah.
Yeah.
So you talked about the rocking mechanism, and the example that I've shared with people in the past when I've explained this is, if somebody has one leg that's shorter than another, our hips are going to be imbalanced because of that. And it's going to affect the way we walk. We have to make certain accommodations in order to deal with that shorter leg. Now, some people can have a shoe made that has a thicker sole. So it, in essence, elevates those so they're more imbalanced. But when we have a jaw joint, we can't just put a simple solution over a tooth. It's going to create that joint or give back harmony into that joint. So it's a little more complex. And the jaw joint itself is much more complex than, say, a knee or a hip or even an elbow.
Yeah, it's really the only joint in our body that rotates, slides, and translates, meaning it does this, and it does this, and it does this, and it does that.
Yeah.
Meaning it's going all these different directions. And it's got basically a sliding cartilage base hooked by ligaments to a ball socket joint that is moving in directions. So everything has to get pulled and pushed and orchestrated the right way, or something goes awry.
Yeah. So for those who see that, if this is like a typical joint and we have a elbow or a hip or something like this, a hip can rotate, and it can rotate in this fashion too. Our jaw joint rotates, but it also slides down this little eminence of bone.
Yeah.
And there's ligaments back here that can attach, that pull things, a little capsule that protects the bone on bone contact. And that sliding can be profound if that disc slips out of place.
Yeah. And I just call that easiest thing for lay people or patients to understand is it's dislocated or dislocating, because a lot of patients say, hey, I hear this clicking, right? I hear this popping. Well, that's a dislocating jaw joint. When it's dislocated, means it's off that ball all the way, and being off the ball, it limits their ability to function where they can't open. And then there goes this whole thing we talk about, bruxism again, right? So this damage of bruxism. So as that dislocated joint comes off, the jaw joint itself slides back and pushes against the nerve bundle and vascularity. It can cause bone degeneration and severe pain, because now things are out of place. You don't have a cushion to bite down onto again in the jaw joint. And then so now when you put that extra pressure from the bruxism, you're causing a neurogenic or neurological pain that goes in through the ear that causes a nerve response pain through your whole face and your head. Causes headaches, migraines, all kinds of different things that go along with that. So it's really fascinating about if one little thing comes off the complex, and that's coming off the complex is because you're putting too much force on your teeth from clenching, grinding, and you get too much inflammation and breaks apart. Well, then everything starts to fall apart. And then, that's when we start getting these chronic pain syndromes that we have to try to get situated back out.
Which is just a spiral compound situation, because once you get bone on bone, once you lose that cartilage that cushions and protects those joints, whether it's in a knee or a hip or in the jaw joint, bone on bone equals bone degenerating.
Absolutely.
We lose the bone. Same thing in a knee. And occasionally I've told patients, when we're dealing with this type of clenching or grinding at nighttime, it's like walking around with a 150-pound backpack on all day, every day.
With a pebble in your shoe.
Yeah. Well, what I mean by the backpack is you've got all this excess weight on your frame and on your hips and on your knees that they weren't really designed to take.
Yeah.
Now, our body's incredible at adapting to adverse conditions, but it can only go so far before it starts to break down, either
Yep.
through inflammation or bone on bone, and these things start to become um, a really significant condition. So let's talk for just a minute about, like, what are the symptoms? What are the comorbidities? What are the things that a patient's going to notice if they have bruxism? So
So
maybe
it can
some of the
be,
common ones, and then maybe some of the uncommon ones.
so super common ones are like tooth sensitivity for no reason. Like, hey, I'm drinking something cold and it's like, ooh, I get a little zing. I feel that. Okay. And that can be a component from this undue bruxism type component. Patient that they start seeing like their gums start getting longer, or their teeth are getting longer, their gums pulling away from their tooth, where like one tooth out of three, the gum starts to drop back down. Well, that's the start and the ramifications of the tooth bending through the bone because of the grinding process. And that can also cause sensitivity. But they say, hey, it looks like I'm getting older. My gums are riding up. Well, they shouldn't be riding up. They shouldn't be recessing back. That recession is because you're losing bone support because the tooth is bending through the bone, and the gum follows the bone. So as the bone breaks down, the gum comes down. You can also start seeing just minor little chips in teeth. It's like, wow, my teeth don't feel smooth anymore. They actually have little ragged edges to them. And those are some of the other things that are early signs of, hey, I'm doing something. So when a patient comes in to see me and they have like a little chip on their front tooth, and I always ask them, I say, what caused that little chip on that front tooth? And they go, I don't know. And it's most probably they're clenching grinding at some time, either daytime or nighttime or both. Or they go, oh, yeah, I remember I bit into a fork. Okay, cool. I like those answers better because it gives me an idea to say, okay, there's some trauma that went on with that. So that's caused that. But if it's an undue chip, they go, I don't know, it just kind of happened. One of the things that patients see is they look at their teeth, they're looking at their smile, and they start seeing the edges of their teeth start getting transparent, where they go, wow, I got this little like see-through line coming through my front teeth. Well, that's wear from behind the teeth, where you're wearing out the inside part of the teeth itself. And that's the outer layer of the enamel that's unsupported from the inside part of the tooth. Okay. Other things that you start seeing that are very common are little potholes and on the top surfaces of your back chewing teeth, where it's like, why do I have a little pothole here? Well, those are fragmented breakdown parts of the enamel from this collision issue that goes along with it. So those are really very commonalities of just simple bruxism or grinding your teeth. It can all lead to like fractures, like breaking a tooth off, breaking off parts of teeth, breaking fillings, breaking crowns. Okay, tooth pressure pain, having the need for multiple root canals. That's also another thing that goes along with that because you're damaging that tooth, causing a nerve response or a breakdown response. Other aspects of some things is with grinding itself. You may wake up or it's hard to get through a meal where you kind of like, hey, I'm chewing, my jaw gets tired. Well, why is it getting tired? It's because you're making it force all the time. And when you go through a meal, you can't get through the meal because your muscles are already tired. It's just like running a marathon and then, hey, I'm going to run another marathon. And that's what's really happening with that. So muscles that get tired or fatigued for no reason. When you try to like open your mouth and it's like, I just can't open, or it hurts to open. Well, that's a muscle spasm issue, and that could be all caused from this undue pressure or clenching and grinding. It can all go to visual disturbances. Eye flutter is a commonality of high inflammation with a nerve response of the optic nerve of the inflammation parts that go along with the spasm of certain ligaments and muscles. Tension-induced headaches, migraines, clicking, popping of the jaw joint, facial pain or like burning or numbness of your face, all other aspects of TMJ related clenching anomalies that go along with that. Would you like more, or is that enough?
No, you hit on a couple ones that I wanted to discuss.
Okay.
These are awesome. So for those of you listening, you may be asking yourself, well, wait a minute, my eyes flutter. That's interesting. Like maybe I should look more into this. Tension headaches, classic symptom. Migraines, clicking, popping in the joint, oral
One of
facial
the
pain.
things I one of the
Yeah,
things I did really say is inner ear disturbance issues are also very common, where we get tinnitus or tinnitus, people call it. And also another one is vertigo, um, which is pressure-induced VPV vertigo issues that can all be associated with an inflammatory component going from the joint into the inner ear with the tinnitus. So both of those work on the same mechanisms, just depending on what the sequelae comes out on it. And those are all things that we see great treatment results with different modes of therapy, being, some kind of orthotic therapy or even laser therapy when we talk about it, as far as for treatment modalities that you can get somebody out of pain and get really change their life when they're having this dizzy, buzzing feeling all the time. And people go to one of the first things they go is they go to the ENT, right? They go,
right.
something's wrong with my ear. I hear this all the time. The ENT goes, we've taken MRI, we took x-rays, we looked in your ear. We don't see anything wrong. Well, maybe you go to your dentist. Maybe it's from clenching, grinding, and your jaw joint issue. So it becomes very hand in hand. But, one of the first things that a patient would say is, I have this issue and it's inside my ear. I'm going to go to the ENT. Great, get it checked out. But if it comes out that they can't find anything wrong, it may be from your clenching, grinding, and jaw joint.
Yeah, excellent. And for those of you watching, if you think about it, our ear canal is right behind our jaw joint. So if we're compressing this and we've got all this inflammation, it's going to have a very obvious connection to our inner ear and this whole mechanism. So very, very common. Tinnitus, ringing in the ears. I call it tinnitus. Some people call it tinnitus. It doesn't matter to me. But the ringing in the ear is a symptom of clenching and grinding.
Yeah.
Mike, you mentioned something that I find very interesting. You mentioned long teeth.
Yeah.
And I want to talk just a minute about long teeth because you said, when we clench our teeth, we're flexing these teeth. And if we remember, teeth are not flexible. They're one of the hardest structures in the body.
Yeah.
So we're constantly putting pressure on this structure that wasn't designed to take that kind of stress. And these teeth are, in essence, bending to a certain extent, which makes the gum and the bone support pull away from the teeth.
Yeah.
And that's where that long tooth comes from. Recession can be a sign of clenching and grinding, which once the gums pull away from the teeth, the roots are exposed, we can end up with more sensitivity. So our teeth are sensitive to cold and fluid changes, whether it's hot or cold, because of that exposed root surface, which was supposed to be covered by the gum.
Correct.
Interesting stuff. So thank you for those explanations. Now I gotta tell you a story. I had a patient that came in to see me who was an incredible, one of the strongest clenchers or grinders I've ever seen. The muscles in his jaw were massive. They were extremely overbuilt. Yeah, flexing those muscles, buddy. Look at it. But he had such tightness in his musculature that he could not open his jaw even wide enough to fit a small marble into his mouth. And so imagine as a dentist trying to do an exam on someone that can only open their mouth by a millimeter smaller than a marble. How do you eat food in that situation?
Well, the easiest answer is tell them don't eat marbles. But well, in regards to that, I mean, it's just bad dental humor. The biggest thing is getting them to release, getting that muscle in spasm. And basically all it is that muscle is like when you go to the gym one day, and you work your arm, you work that bicep, and you overwork that bicep and the bicep tears and you get all this inflammation in this bicep. And then it gets the next day, it's sore and it gets stiff and it can't move. Well, that's the same thing that goes along with this power stroking muscle, this masseter, which smashes through and brings everything together. And so as that muscle gets into that tonic static spasm relationship, they just don't want to open. They're just like having lockjaw because it's totally on fire. It won't shut down because of its spastic nature. And that masseter has to shut down so you can open to elongate. The masseter's design is to smash and crash. It brings your jaw together. You have other ligaments and muscles that help bring your jaw open. And if that muscle is too much inflamed and it can't release its tension or its contraction, then you can't open. It causes a lot of pain, but it also causes a lot of is something wrong with me? Do I have lockjaw? Or are there other things that are helping to cause it? I can't open my jaw. So it's a big problem. Could all be just from that. Hey, I'm putting my teeth together too much over time during daytime and nighttime, and it's not allowing the muscle base to shut down, to decompress itself, to allow it to go to relaxation mode and stop spasming.
Yeah, thank you for that. For those of you listening, masseter is the muscle that's right here in our jaw. And this is one of the primary muscles that we use to close our teeth together. And when you see in the movie somebody that's this handsome Westerner punching his jaw and showing off this muscle, like Dr. Mike here, that's the masseter muscle. But here's the problem. It's kind of like an alligator. An alligator can clench down with incredible force, but the muscles that they use to open are tiny. Which, if you ever watch a alligator wrestler, they always hold the alligator's mouth closed with their hands, because once that alligator's open, if it snaps down, it's all over. But they don't have the musculature that's built up enough to actually open with enough force that even our hands can keep their mouth shut. Yeah. So we see this in our bruxism, in our clenching patients, where their musculature is overdeveloped to create an imbalance. Our teeth were never designed to take that kind of force.
Correct.
So thank you for that.
It's more than the teeth design. It's the supporting structures around it. The little fibers that hold the tooth in place in the bone, the gums, and then the rest of the supported structures going in through there. It's just not designed for that constant overfunctioning.
Yeah. Fascinating stuff for me. Fascinating stuff. What do you think are the root causes of this? Like, what we talked a little bit at the start about, stress. Are there any other things we want to talk about that are causes of bruxism? Like,
there's so many things that can cause somebody to bring their teeth together or bring their teeth together unduly, unwarranted. One is sleep-related breathing problems or sleep apnea, or a respiratory issue where they can't breathe. Like they can't breathe through their nose, so they have to hold their jaw open to breathe. Well, that's overfiring the muscles. And then when they go to swallow, they have to over clench their teeth to swallow because they're trying to put pressure back because their jaw's filling with fluid. So that's one of the things that also can cause an undue factor there. Now, some of the other things that go along with that is, nerve responses are issues where you're having overfiring of nerves for any reason, and it could just be stress oriented. Certain medications and drugs can cause you to clench your teeth more. As I said, airway is one of the big ones. A situation where you have like a pressure developing in your sinuses, and you get like the swelling. You probably had that, and a lot of patients have had that too. They go, "Hey, I got this little stuffiness and this little pressure. I have all these teeth that hurt." And they're all through these back areas. Well, as you get the swelling of the sinus membrane and you bring your teeth together, those teeth actually swell down a little bit. And your body's response is, hey, I'm trying to put pressure back on them to put them back in. And they get sore, they get inflamed. And when they get inflamed, they get painful. The same thing goes along with an inflamed tooth, where you bite into something in a sandwich and it's hard and you hit a tooth and it gets swelling underneath it because it gets a jolt that smacks it. Well, if you get swelling underneath that tooth into the bone, then your body's response is, hey, I'm diddling with it. And diddling is a pretty common term because they're kind of hitting, smashing, and they're gooling around it because they're trying to figure out, can I get rid of this inflammation or not, or is it going to keep hurting? And so there's a lot of different reasons why um, patients will put their teeth together more than just chewing. Um, and a lot of them, we don't know why, because it's a nerve response. It's a host body's response. Medications, nerve disorders, immune disorders, airway type breakdown disorders, drug addiction disorders, certain medications, or prescription medications that can upset the neurobalance that cause you to also brux or grind your teeth together at certain times.
It's interesting because there's so many things that could
Yeah,
trigger this,
a
and it's a
lot.
very complex situation. And I tell people all the time, and I know you agree with this because we've talked about this before, but if you're dealing with clenching and grinding issues, I would highly encourage you to go and have a sleep test done,
Oh yeah,
because the chances of having sleep apnea concurrently with these types of clenching and grinding issues, the correlation is high.
it is
And
very large.
so it's a huge risk. And sleep apnea is also another field, which would be another great podcast series in treating sleep apnea, because those are very correlated together. You know, you can't separate them out because they're usually concurrent. They're running concurrently.
Correct.
So thank you for that. So let's talk about like why do we think bruxism is a concern and not just something like, well, hey, this is just the way I'm hardwired? Like, what happens if I say, listen, I'm a clencher, big deal. It's not going to change anything. What are the ramifications of not dealing with this condition?
Yeah, and I see a lot of this in my practice. I have an extremely large proportion of my practice is dealing just with TMJ pain. And what I see is over time, a lot of these patients are coming in, and it started out as that, yeah, I used to grind my teeth when I was a kid, and I ground through high school, and I started realizing that my teeth were getting sensitive, or I started chipping teeth, so I started breaking teeth. So one of the biggest things is tooth loss, because if you have overforce, overfunction for that amount of times, you're going to wear your teeth down. As you wear them down, they may just wear down, or if you catch it a certain way, they may break, chip, and fracture. And so this tooth grinding issue, you get a higher chance of tooth loss or edentalism. You also have a higher chance of getting periodontal disease because you're inflaming the bone all the time. You're making it more susceptible to bacteria and to pathogens getting in there to cause gum disease. And as your gum recesses from this undue pressure where the teeth are getting longer, well, that also causes the breakdown of bone and higher chance of getting bacteria underneath it where you can't clean it out, which causes more periodontal type of issues. Um, Between chipping, breaking, tooth loss, there's also the ramifications of pain, jaw pain, facial pain, undescribed facial pain. And those are things that can be life altering, because as they go through this chronic pain syndrome, then they have other things that go along with this hyper-inflamed zone of their body, because basically that's what's happening. Certain area of their body is getting inflamed, and that inflammation can go throughout the rest of their system. It can cause other types of disorders that go along with an inflammatory type condition for your whole body. So it's got huge ramifications with other comorbidities, we would say. And so, yeah, it is an important factor. So trying to get somebody to either protect it or to help alleviate the symptomology of it by some other things I know we'll talk about later, as far as some mechanisms to try to get feedback in their system to help shut it down, to give the neuro response time to say, hey, don't do this. Hey, don't do this. It's the same thing as you tell your child, don't touch that hot stove, right? And you keep telling them, and they just gotta touch that hot stove because you keep telling them, don't touch that hot stove. And they go to touch the hot stove finally, and they go, it burns, right? Well, that's what we're going to talk about later on, is this neuro response mechanism of, can we get this neuro response to start shutting down so we can retrain the body's nervous system to not clench and grind.
Excellent. Excellent. one of the things you mentioned, so obviously if I'm clenching and putting undue stress on my teeth, I can break my teeth.
Break your
So,
teeth.
so people will say, listen, I've broken several teeth. They're missing teeth here and there. That's a sign of clenching and grinding. It's also a sign of bad oral health care, but they can be synonymous or they can run together. We talk about headaches, patients dealing with headaches all day long. Like, why do I always have headaches? Well, maybe there's an association with this neurovascular, meaning the brain and the nerve and the vascular, the blood component of these conditions. We talk a little bit about pain. I've had patients that have had just incredible neck pain. And so they go see a physical therapist to deal with this condition when in actuality, it'd probably be better managed initially in a dental office to either rule out or say, hey, listen, you've got an imbalance in your joint and we need to deal with this.
Yeah, we see a lot of that with our TMJ patients with concomitant neck pain. And
Yes.
we do, and then a lot of that has to do with we call forward head posture issues,
Yes.
or poor cervical type issues, because as the jaw goes out, you get change in position of how the jaw has to function, which also gives a head tilt response to it, which can cause cervical type of stenosis issues. And there's a lot of other neck issues that go along with it. And the biggest pain they have is the supporting musculature coming from all the way up, all the way through here, that causes this chronic fatigue pain syndrome that goes along with it. So yeah, a lot of neck issues.
Yeah, so negative outcomes, headaches, tooth loss, periodontal disease. I'm going to come back to that in a minute. Neck pain, joint breakdown, like I'm clicking and popping, which leads to degeneration
Correct.
of the joint, which has very significant complications later down the road.
Yeah.
Let's talk for just a minute about periodontal disease. I don't want to migrate down that path because again, that's a whole nother,
That's another podcast.
multi-part series.
Yeah.
But the problem that I've seen with periodontal disease is when we have inflammation around our teeth, our mouth is a pathway to the whole system.
Right.
And these bacteria can migrate through the gums into the system and have a very devastating impact on cardiovascular health, on mental health, on all of these systems. So we've seen a link between periodontal disease and cardiac disease, as well as Alzheimer's and diabetes and these types of things. So we do take it very seriously. For those of you who say, as a badge of pride, oh, I haven't seen a dentist in 5 years, that's not a good thing.
Not a good badge to wear.
Yeah, it can have devastating effect on your heart, on your head, and all of these different systems. So, and perio can be a side effect of clenching and grinding. So, so thank you for sharing that. This kind of ties into my last question, and then we're going to kind of wrap it up. I want to talk a little bit about treatment and prognosis, but I don't want to go into that because we're going to do that at a different episode. But like for somebody that's listening to this, you've heard a lot of the things we've talked about, like, hey, I think I have that. And I remember, Mike, you probably did the same thing. When we're sitting in dental school, we go through a pathology class, and pathology means bad things that can happen to the body. And when you're sitting there looking at all these different slides of bad things that can happen, you start to say, hey, wait a minute, I've got that. Oh, I've got that. And it starts to introduce all these questions into your brain, like, well, maybe I have this syndrome and maybe I have that syndrome. For those of you who are listening, if these things we're talking about kind of ring true to you, like, hey, I have ringing in my ears, is this a problem with clenching? We would encourage you to follow up with somebody who is a subject expert or who knows at least enough to help you with this, to do this. But let's talk for just a minute as we wrap up. How do I know, as a common person who maybe doesn't have the same level of expertise as you and I do, how do you know if you have bruxism?
As I said earlier, one of the early components that you see is your jaw may get tired trying to eat through a meal. You can't eat through a meal. That's super common. The sensitivity, the little chippy things that you don't, it's like one day it's there, one day it's like, so what happened? I didn't have that there before. The translucency of teeth, sensitive cold sensitivity issues on teeth. if you can't open your jaw very wide. Also the ringing in your ears, the visual eye disturbances. There's so many little symptomologies that can go with it, that can have lots of effect on their health and their life. So really the biggest thing is get screened for, do you have some kind of bite anomaly that's going on that you're seeing that something's wearing wrong with your teeth or your jaw? And because a lot of that can save your teeth. I mean, early intervention for this type of a situation is key, because if you can save it, protect it, then you're not going to have a lot of other component problems are going to go on as you get older in life, where things can get worsened over time. And then some of the easy fixes are thrown out the window because it's not easy anymore. So the longer this breakdown goes, the more ramifications it can have with your general overall health, and then the prognosis of keeping you working in a normal manner, chewing, eating, smiling, gets harder. So, that's a hard question to ask, is what to look for. My gosh, I gave you, 30 things that you have that can go on. So, but if you start seeing, I wonder if that issue that I'm seeing, I'm hearing, that I can hear my teeth squeak, or I'm having a hard time chewing, or my bite feels different. Like you wake up in the morning and go, I'm like hunting and pecking. Where does my bite go? Well, that's
Your
an
teeth don't
inflammatory
know where they
disturbance
fit.
because you're getting swelling from nighttime to daytime. So if you have
Yeah.
constant bite changes, well, that's a symptomology. You can have some clenching, grinding joint anomalies that are going on with it. So there's so many little factors that you can put to this condition, where you can have the symptoms that correlate to the clenching and grinding itself. So it's not just one. If I have one, oh, this is it. No, it's like, hey, all these little things starting to add up. And the
Yeah.
biggest thing is if you go, you have some kind of facial anomaly that's going on where you go, I don't know what's causing this. Ask your professionals, because, that's one thing that we have as far as in whole body health, and as far as a dentist that's looking beyond just a tooth, of there's a lot of things that can go on that we can benefit by doing some early intervention treatment and getting it so we're not inflaming, and giving some prevention instead of trying to fix things in the long run because it's already gone too far or broken.
Yeah, that's great advice. It's kind of like what I tell people. If you think you have a cancer, you don't want to wait to get a diagnosis. The sooner you get on top of that, the
Yeah,
better the prognosis. Same thing with a jaw joint issue. The sooner we approach this, the more positive impact we can have, the more conservative treatment that we can offer.
absolutely. Yeah,
For example, I have patients that have had their jaw joint replaced because they've worn it down so severely. That is an awful scenario, and it is never a good scenario. Instead, preventing that jaw from wearing away would have
correct.
been a much, much, much better option.
Yeah, and we have lots of options now to prevent it. It's just whatever suits that patient's condition, because everybody's different. And, we need to find out the most conservative route to get them the best benefit. And, that's why we want to look at whole body health, and, what can we do to make it so we can keep them healthy,
Yeah.
without having other problems or sequelae.
Yeah. And I want to talk, not in this episode, but in a future episode, about treatment and prognosis. There's so many options we have today to offer. Some of them are quite simple, some of them are easy, some of them you can get over the counter, some of
Yeah.
them I don't recommend you get over the counter. There's a lot of different things we can do. But with this range of treatments that we have available to us, and these are only getting better with time,
Yeah.
is there hope for
I
those
think
people
there
that are
is.
suffering from this?
Yeah, I believe there is hope as long as the person that's suffering wants to get help. That's the biggest thing. You also, if you go somewhere and you say, okay, that's all good, I grind my teeth. Okay, well, if you don't want the help, then yeah, you're going to have further problems. But if you're acceptable towards a minimalized treatment and a conservative treatment, then you could get big benefits from early intervention and early treatment to solve this problem, so you don't have further things on. So it's all down to the patient of, if you have something that's going on, the sometimes the simplest thing is the earliest thing that you can do.
Absolutely.
Yeah.
Absolutely. And I agree with you, Mike. There is so much hope for those that are suffering from these conditions. Obviously, the sooner we deal with this, the better it will be. I never recommend delaying any type of treatment. And the more prevention we take, the less dramatic the ramifications of
Absolutely.
not dealing with it.
Yeah.
So I agree. There's definitely hope, and there's a lot of things that we can do, and there's a big range of things we can do.
Good.
I have some people say, well, I can't afford to do that. Well, we can work with you to find a solution that helps you. It may not be the ultimate solution, but at least it can help.
One of the things I like to put on that aspect when somebody tells me that is, can you afford not to?
Absolutely.
You know, because if it something goes wrong, you know, and we don't ever want it to happen where you snap and break some teeth off because you are grinding. Well, that's going to be a lot more time consuming and expensive, and you know, and it may have some more discomfort involved in it than if we can go ahead and protect it in the early stage.
Yeah. So stay tuned with us for upcoming episodes about treatment options. In
Absolutely.
conclusion, Mike, I want to thank you so much for your time. You're just a real inspiration in this field. I know so many people follow you.
Yeah.
Now is your turn if you'd like to promote. Like, do you have social sites? Do you have products? Do you have anything that you would like to just plug real quickly?
You know, I do. I have an education site that I teach doctors on. It's called Biting Education. Pretty simple. My practice is the biting edge. So, I mean, that's it kind of goes hand in hand on that. And, you know, I do a lot of small scale and big scale education programs that are all related to a personalized type of help for doctors. One of my goals is education. And this is interesting, is my education goal is I can help so many people in my office, right? But if I can help 4 or 5 more doctors every month, they can help an exponential amount more patients to get healthy and stay healthy. So the
Absolutely.
reason I educate is because it's making more people healthy. And it's just super important to be able to have somebody have the light turn on and go, oh my gosh, I didn't know I could do that and be so successful. Successful meaning getting people healthy. And that's a great, great thing to be able to share that type of experience and knowledge, and making it so they can share that experience and knowledge across the board to get more people healthy. So yes, I do have my own education, Biting Education. There's another group that I belong to, is Clinical Mastery Series, was another education series treating doctors for other needs as far as cosmetics and bite problem type of a thing. I do have a pain management site where it's a product, and I know you have used this product, Scott.
I have
It
indeed.
has worked really, really well. It's called TTP, which is Treat the Pain. And it's a CBD CBG varietal for pain, muscle skeletal type pain or inflammation caused by muscle pain type of issues or overfunctioning or other neurological issues. So we do have that. It is ttpcbd.com is the particular site where we have therapeutics for people to use. So those are some of the things that we have. So my practice, my education site, and then we also have that therapeutic company that we have too. So and so we see lots of great things with that. I do have an Instagram, it's Dr. Mike at the Biting Edge. And Facebook, I believe in my Facebook is the Biting Edge. So, but if you're Instagram me, it's Dr. Mike at the Biting Edge. And I answer to all kinds of different things, but you can find me on, you do the Google thing and it comes up as Dr. Mike at the Biting Edge. So that's usually a good way to
Perfect.
find me.
Thank you for sharing that. And for those of you interested in CBD, CBG for anti-inflammatory effects, I would encourage you to go and check out TTP. I've used it personally, and it made a tremendous difference. Mike, I'm a bicycle rider. I got hit by a truck last September, so it's been about a month. In fact, it's been a year now. And my recovery using your anti-inflammatory was just invaluable, especially for my shoulder, because I landed on my shoulder. And so I want to thank you for making these types of products, which for me made a tremendous difference.
Absolutely. Yeah.
And we also see a big difference in those who have jaw joint inflammation. So
Yeah, and
really
the
helpful.
inflammation from clenching, grinding, the muscles get sore. It helps to de-inflame them and shut them down. So it makes a big difference for comfort.
Yeah, yeah, love that product. Thank you. And also, for those of you listening, we will be talking about Zerene
Yeah,
in upcoming podcasts about how this is also a really nice option for you that you can use. It's inexpensive, it's easy to use. We're seeing great benefits. And as you know, this podcast is actually produced by Zerene Inc., and they're a developer of innovative data-driven solutions for people who clench and grind their teeth while they sleep. And they're developing other things, which we can't really discuss at this point, but they're a very innovative company. I love Zerene. I've been really happy to see what they're doing with some of these things, which are a really simple solution for people who say, maybe I can't afford to get into a dentist right now. Now, I don't encourage that, but I also am realistic enough to know that some people need to start somewhere.
absolutely.
So
Yeah.
if you suffer from teeth clenching and grinding, please visit zerenelife.com. This should pop up on your screen, but Zerene is Zerenelife, zerenelife.com, to learn more about how that product might work for you. Mike, I want to thank you for your time tonight. It's been a really enlightening conversation. I've enjoyed it. Thanks again for being here. Lauren, thank you for hosting with
Thank you,
Zerene.
Lauren.
And for all of you there, we look forward to more feedback, and stay tuned for more podcasts as we continue to roll out more information for you.
Absolutely. Thank you very much for having me tonight. If you have questions, you can always hit me on email at drmike@thebitingedge.com. That's me, my practice. I answer to that. And I'm happy to help people whenever I can.
Fantastic discussion. Thank you so much.
Thank you.